While you're asleep in surgery, your sling will be positioned like this. You'll go home with dressing similar to this in place. In about 2 or 3 days' time, go ahead and remove the dressings over top. There'll be gauze and tape. Underneath, you'll find these steri-strips and the incisions underneath. You want to leave the steri-strips on until they fall off. There should be dissolvable sutures underneath, which will prevent the need for those to be removed in clinic. After your surgery, it's important that we protect your repair, and by that, I remind patients to treat the shoulder like a wet noodle, and this avoids actively firing the muscles around the shoulder that would pull on your repair. However, you will need to come out of your sling 3 times a day for multiple reasons. First, to work on range of motion of the elbow, wrist, and finger, and also for hygiene. You'll see our model is supporting the wrist and forearm with his hand and relaxing the muscles of the shoulder. To work on elbow range of motion, you'll simply let the elbow fall to the side, and you can bend it up either on its own power or with the assistance of your other hand. We'll work on supination, which is where we rotate the forearm palm up with the elbow at the side, and pronation by rotating it palm down. For finger range of motion, we'll want to do 4 main exercises. We'll want to straighten the fingers. We'll want to bend them like an L, and then a J, and then make a grip. And while you're swollen, you may need the other hand to help with these tasks. When it's time to start hygiene, a couple days after surgery, you'll be able to take a shower. When you're doing that, you want to simply lean forward and let the arm hang at the side, again, using the shoulder like a wet noodle, and that allows you to scrub underneath your armpit and then also to dry that area out afterwards. In addition, we want to work on posture and rhomboid isometrics after surgery. This ensures that you're not abnormally using the muscles around the shoulder, which could cause cramping and even compromise your outcome. 3 times a day, you'll want to do sets of 15 seconds, 8 reps of pulling the shoulders back towards themselves as if you're pinching a towel between the shoulder blades. And this will tighten up the muscles around the shoulder. In addition, you can look in a mirror and make sure you're holding yourself with symmetric posture, and that will make sure that things are nice and aligned, so when we do start strengthening and more aggressive motion, you're on pace. At the time of surgery, your sling will be fit to you. It's important that you know how to adjust the sling at home by yourself, as you'll have minimal assist, so you want to hit the ground running. It's important that when you're not wearing the sling, again, the elbow is treated like a wet noodle and allowed to fall down, as is the shoulder. Matt's going to go ahead and set the sling up either on a pillow on your bed or on a couch, countertop, or desk. And you want to bring it to the correct height that you can simply drop your arm in safely. So Matt's going to go ahead and support his arm. He's going to fit it inside the sling and go ahead and sit down and allow it to hang down. He's going to move the elbow back all the way in the sling. Next, he's going to use his non-operative arm to secure the straps around it, as well as the strap around the thumb. And he should already have the waistband waiting for him, and he'll pull that from behind and secure it to the sling with the use of the operative fingers. He'll go ahead and reach behind him again and grab the shoulder strap. And again, he may need the operative arm to help with this as well, but it's safe as long as it's supported in the sling. It's important to note that the sling is not brought across the belly, but rather is at the side with the forearms pointing straight ahead. Go ahead and stand up and twist to the side here, and we'll show you here. You want the arm in line with the axis of the body, not necessarily back here or up here. And that will help protect your repair. It will also be more comfortable for you.